Well, welcome. See if I can get this technology working as well as we work with the E-Matrix. Looks like now I think I'm ready to roll here. So what we're talking about is quite different from what you probably heard because the fractionated laser stuff has been out for the last couple of years, and that's pretty much where all the action in lasers has been. And the E-Matrix takes the fractionated system, but really does it very differently by using RF alone, without using any optical light, to achieve results that can be quite good as well. Let's see if I can get slides. Here we go. Perfect. So we're going to talk a little bit about where the market is, how the E-Matrix works, take a look at what it looks like, how to use it, and some before and afters, and then they'll talk to you about, of course, how to make it fit into your practice as well. As far as in this challenging economy, it's sort of always going to be a challenge deciding what you should incorporate in your practice when you know that there's definitely a lot of patients are kind of on the fence as to what they may or may not do, or what they are ready to do, and whether they have the money for it right now. So the fractional ablative for skin resurfacing market is rapidly been growing, as of course the other traditional resurfacing has been going away and pretty much replaced by the fractional resurfacing, because it's less downtime with the results that are getting quite as good as similar to what traditional resurfacing was. So there's been rapid growth. There's continued growth projected, even with the economy being down, partly because you're looking at this is a lower cost item than some bigger procedures. I think much bigger cosmetic procedures like facelifts are hurting much more than the less invasive type procedures. And just looking at the volume of fractional treatment, this would be both ablative and non-ablative. Again, it's sort of on a rapid trajectory upwards. So the number of treatments continues to increase, and is projected to continue to increase going forward. Your fractional technologies, I kind of alluded to this. We're really talking about mostly lasers, but here we're going to be talking about RF. So traditionally resurfacing, you remove the entire layer of skin, the epidermis and part of the dermis. Very aggressive, longer downtime, problems with long-term hypopigmentation and scarring in some patients. Even though the results are quite good, just the downtime and the risks turn people away from that. And I have not turned on my resurfacing laser for the last 2.5 years. So we basically totally stopped using it. And there was a time I was using that laser almost every single day in my practice. So that business has totally gone away, and the fractional skin resurfacing has really taken that over. You're removing only a fraction of the skin layer, so you're leaving a reservoir of unaffected tissue so that you can get healing with much less downtime. And then depending on if you're doing ablative versus non-ablative, you have different amounts of downtime. Also, how deep you go also affects that. So here's just to kind of show that if you're doing, there is ablation and coagulation, and what that kind of show that subsequent ablation really equals to coagulation, because what happens is you do that immediate vaporization, and then there is some thermal energy deposited, which causes thermal coagulation or necrosis, and then that at some point sloughs off in the following week or so. And so the amount of injury you get is actually the combination of the two, whichever one you get. So it's not necessarily one is better than the other, because I think it's what the combination will achieve is what you're looking for. There's two types of fractional skin resurfacing impacts. You have the ones where you get deep injury with low percentage coverage, small holes and go very deep. And then there's the other one is where you do very high number of impact spots covering a large area but go more superficial. And it actually turns out that the downtime often is related more to superficial, I find. When you do the big coverage, it affects the downtime more than when you're going deeper. When you go deeper, the main difference is when you go deeper, you have it tends to hurt more. So superficial, wide is maybe less painful, but it has more downtime. And you choose what you would use depending on your indication. And with a lot of the devices out there, you can really do only one or the other. And the benefit here, what we're going to hopefully show you, is that you can kind of pick and choose how much you want of one versus the other. So here's just different technologies out there. You have the Nd:YAG at 1440, which gives you primarily coagulation. You go to erbium glass, you go deeper with coagulation, and you go into the erbium YAG laser area where it's primarily ablation, and it's very superficial. And CO2 can give you a little bit of both. You can either do it but primarily there you're doing a lot more vaporization, ablation, and some coagulation around the edges. And you can sort of see how the tissue removal goes as far as the surface at the bottom. It shows the percentage of tissue removed with the device. Trying to get the slides to go forward, but I'm not getting anywhere right now. It seems to be freezing up on me. Here we go. Okay. So those are the optical methods. They're using various near visible or near infrared sources. Now with what we're doing here with eMatrix is we're using radio frequency, not optical, so you can use it really color blind to skin. So if the patient has a tan or if they have a darker skin type, it has no effect. The energy goes through the skin and doesn't even notice what it is. With optical energy, you always have to be worried about how much melanin is in skin, because it can potentially cause hypopigmentation if you do aggressive treatment. So any skin type can be treated. The Matrix RF is it's first RF only ablative fractional technology. It's and it comes basically in two ways. You can get it as a standalone device, as an eMatrix, or as a handpiece that's attached. If you have some of the Syneron products to the eLaser platform, where it can be used just as an attachment. So if you have that, you don't have to buy the whole unit; just buy the attachment. So the technology is different from optical. What you have is a grid, and currently it's got a 64-pin grid, which then has electricity applied to it, and the energy goes between you see the yellow dots is where the electricity comes in, positive, negative, 2 rows, and so you basically have the electricity moves from positive to negative and negative to positive, and so it sets up a bipolar radio frequency source, and so when it travels from one electrode to the other, it goes through the skin in that area and causes a small coagulation or ablation depending on the spot, depending on how much energy is applied to the spot. And you get 64 of these, and then this device can also have potentially other groupings. In our study, we used 144, and there are all kinds of other combinations possible. But right now, the commercially used version is 64 impact zones. And here is sort of where the idea where it fits in. There are a couple of other Syneron devices mentioned here. The Matrix RF is really designed for treating the epidermis and then the upper to mid dermis. Then when you want to go deeper, you would then use some of the other devices like the Matrix IR, which is infrared, and Refirm ST, which also uses RF and thermal energy to go even deeper. But the Matrix RF is really designed for dealing with skin texture changes, pigment changes, fine to moderate wrinkles, and fine to moderate scarring. Once you get into deep wrinkles, deep folds, then you want to be adding on some of the other devices in combination. And so here, what you do is when you have the device, you can then choose how much you're going to do. So you have 3 programs. If you want very mild and gentle treatment, all you do is you set it on the mild one where you don't have to use any anesthetic, and you get a very superficial coagulation with a little bit of ablation, mostly coagulation that's superficially, and that's for patients who just have some mild textural changes and pigment changes. Then you go into the program B, just switch to the next program, and then you get a little bit more ablation and a little bit more coagulation for patients who are sort of in your average category, and then program C when you want to get really into the dermis with your ablation and coagulation. So you go into the mid dermis, and that's for the deeper wrinkles, more sun damage, and certainly I find that this is, to me, program C is the one that really is the one to use for if you have patients with acne scars that you want to treat, because those are a lot tougher to make progress on. So there's the histology. You can see program A. You have barely just a little bit of epidermal coagulation here. Very subtle changes in the dermis. So it's very mild. While if you go the other extreme, program C, you can see ablation. Here you have ablation into the dermis, and then a zone of coagulation below. And here's another version of it where you can set program C to either do a more ablation and less coagulation, or more coagulation, less ablation. So this would be, here is the 5% gives you the more ablation, and then when you do 10% coverage, you get a little bit less ablation. You can see a little bit of epidermis is still left, but you have a much deeper zone of coagulation. And you just set it based on your indication. Here's showing the healing immediately after. What happens is then within a day or two, you have the epidermis, all that stuff comes off, and there's new epidermis underneath. And then in here, you can start seeing some of the changes in the collagen. They mentioned it's difficult to see, at least even for me, but there are changes. You see how you get some inflammation, fibroblast activation, which then results in additional collagen production. So the device is very it's about the size of it's almost basically the size of a computer, basically, of a personal computer. You've got a screen and then a small box underneath. Totally portable. You can just move it from room to room or from room to office, which at least for us works very well in our office, because we usually at least move it around the office all day. So it's very straightforward. Can think of it as being quite elegant. Looks straightforward. The one good thing about this is, and that depends on your state and practice, but in Missouri we certainly are able to delegate some of the non-invasive procedures, and this certainly lends itself to quite well, because as you'll see the use, once you figure out a few parameters, it's very straightforward to use. I'm just getting some slow movement on my slides. Actually, I'm not getting any movement right now. But there we go. So you have a logging screen just to make sure that no one uses it who's not supposed to use it. Select the patient gender, and then you've got some other services. What you then do is you basically select each area of the face, because what you often do, you don't just set it to one setting for the whole face. So you may end up using, if I have someone with acne scars on their cheeks, but I'm still treating the whole face to get uniformity, and they have some textural changes, so I may be using program B, and then on the cheeks I will use program C to get more. So you select each area, and then you on the screen you basically click on that, and then put in your program and start going. Because you select the area, and then you say it's going to be only A, B, or C. And then after you've treated that area and you want to treat another area, you do the same thing, click on it, and then just select the different area, the different setting, depending on what you're trying to treat. And here's the layout. It even shows you, so you don't even have to kind of remember how it's supposed to be. It shows you the diagrams I show you. This is when this one is program A, you're getting mainly coagulation and just a little superficial coagulation. So that's all you do, and a little bit of maybe ablation right on the upper epidermis. And that applies to programs A, B, and C, and then you can, it kind of shows you graphically. You don't even have to read anything there. So with that, you get the system, the applicator, and then treatment tips and test tips. And how that works is that the tips do have kind of like a timer in them that they give you some number of pulses. So that works is you stick it on, it knows that it's ready to go, and then you can go for 125 pulses, which for this device, which I think the handpiece is, the tip is about 2 centimeter diameter, 2 centimeter on side, and so pretty much cover the whole face with 125 pulses. This is unlike things like Fraxel, where you're doing 8 or 10 or 12 passes. You just do one pass with the device, just one pulse after the other, go over the whole face. So it can move pretty quickly. The one thing you do have to do here is there is debris that builds up over time as you do pulses from the RF and from the ablation. So every 25 pulses, you do need to clean it, and actually you get a little warning saying, okay, time to clean. Sometimes you clean a little bit more often, and that's fine, but certainly do it every 25 pulses. If you get a lot of debris builds up, your effectiveness tends to go down. So that's the one little item that you need to do. But it's also good because it gives the patient a little break, so that because even though this is tolerable and we do this all under topical anesthesia, it still has a bit of a bite to it. It still stings a bit. So giving them a little bit of a break every 20-25 pulses is reasonable. So the concept again is that this is only RF only fractional ablative technology, and so that gives you something that's unique. And at least we find in our area that means that we are the only ones that have this, and that helps a lot in the marketing and in getting patients interested in using it. Because if you have something that all the other med spas down the street have, then it's difficult to convince patients that necessarily that they need to come, they should come to you. But this is sort of something very new and different, and has some nice attributes. The downtime, we didn't talk much about that, but the downtime is very minimal. Right after treatment, patients do have redness, and then they have these very fine dots from where they had the ablated spots, which come off, depending on how deep you went, 24 to 48 hours. If you're very aggressive on the C type, then maybe you may at 3 days. But it's certainly not something that patients can't be out there, because we do let them put makeup on their face afterwards. So it's not a big deal. And compared to what we have, and I think of it in terms of when we have the non-ablative Fraxel treatment, it's about a 2-3 day downtime with the redness and swelling. And when you get into ablative Fraxel treatment, I find that it's not quite ablative resurfacing as we used to do it, but still they have days of oozing and draining and redness. So it's not nearly as mellow. So this is something in between that kind of, and we are doing a little bit of both ablation and coagulation, and this sort of, the downtime is somewhere in between as well. So here are just sort of the features. It's a small system. You got the disposable tips. So you get this. It comes with basically enough for 10 treatments. The bipolar RF, and the nice thing about this Select Pulse is that you really have it's sort of like having 3 devices in one, or really 2 devices, but you can combine it so that's a third one, because you can do almost all coagulation, so you have non-ablative fractional resurfacing. You can do mostly ablation, so you get fractionated ablative resurfacing, or you can combine the two. So you can really customize it to your specific patient's needs. It goes very quickly. It takes us 20 minutes at the most to do a face, and you can use it anywhere on the body as well, so you can really move through pretty quickly. Generally, we do go for about 3 treatments 4 weeks apart, so it's similar to some of the other, mainly more like the ablative ones. With non-ablative, if it's purely non-ablative, often we do 5 or 6 treatments. We've certainly, in our trial, we've had some good success in getting some nice results. I'll show you a couple of before and afters in a minute. Treatment protocol very straightforward, and as I said, in our practice we are able to delegate our treatment, so it's I think quite very, very useful for us. So indications, the FDA clearance, this is the FDA labeling. It's for dermatologic procedures requiring ablation of and skin resurfacing. So that, of course, covers all your wrinkles, texture, acne scars, and all the different indications we do for resurfacing. I'm trying to get my slides to move forward. Here we go. Results. So here we have a couple. So Dr. Taub is the other main investigator in our 2-center trial. So her assessment that can do it in 20 minutes. very easy to use, and I agree the handpiece is very, very light, easy to use. The results have been quite good. Patients find it quite tolerable. So our feeling is that this could compete favorably with fractional CO2. And there's also some tightening we've seen, primarily when we weren't really looking as much for tightening in our study, but we noticed that along the way, while we were looking for the wrinkles, especially when we were working on the cheeks, we got some of the jowls seem to really be able to reduce those. And the patients overall quite happy. From my experience, I was most impressed in our study in the periorbital wrinkles. Those I thought were most dramatically improved, and then also the cheeks I thought did really well. And then surprisingly, the glabella, which I did not expect to do well, and even the glabella, we saw some nice improvement. And the texture of the skin certainly improved, which a lot of devices will do. Because what I'm really looking for is, can I affect a little bit deeper in there? So in our practice, since we do have a number of the Syneron devices, we really incorporated with some of the other features, like you saw the diagram where we can do on the same patient. We use the ST, the IR, and the Matrix RF all in one sitting. And maybe in the Matrix RF, I might not then use on the whole face, but on the specific areas where I'm really trying to get to those to the wrinkles. So I thought it was the results certainly were very, very good, and quite pleased. This is one of my patients. Where we did would be like the B level. In our study, we were not able to really we did not have the C level treatment, which is the more aggressive treatment. So we just recently got that, and we're excited about extending our results. But you can sort of see in the periorbital area quite significant reduction in the lines on the patient. So that's kind of what we see, and it's kind of something we saw quite regularly. Here we have another one. If you look right through here in the crow's feet area, this is really cleaned up, that whole area, and even if you look under the eyes as well, and you can use it on the eyelids. It is a more sensitive area right here, so sometimes you can't run through that too quickly. Kind of to give patients a little breather. When we do treat there, just pull the eyelid down so that we pretty much treating against the bone underneath, as opposed to trying to put the energy. You don't really want to be zapping into the orbit, so you kind of pull down. But you can get pretty high up on the eyelid and pulling it down onto the lower orbital rim. This is one of Dr. Taub's patients. This is really looking more at some of the skin texture changes, a little bit more subtle tightening there as well. And here's an older patient, which I think this patient, she does show some improvement. If you look at right here, this is where if I had the C program, this is the kind of patient that would definitely benefit from using the C level program to really get at some of these deeper wrinkles. The protocol pretty straightforward. You pick the laser that you want based on the indication. So program A, minimal downtime, and you're looking at really skin texture and maybe a little bit of pigment, but primarily skin texture, just kind of a freshening up. Medium downtime, program B, where you get a little bit 2 to 3 days. Then you've got you could do for some of the epidermal pigmented lesions, and then some a little bit more significant texture irregularities and some superficial acne scarring. And then once you get into the program C, that's really where I'm looking at for deep wrinkles and primarily acne. That's where I would my workhorse for acne scars. But you do get a little bit more downtime. It says high downtime, 3 to 5 days. That's not quite the same, again, as the resurfacing, but you do have those dots, and they take 3 to 4 days to come off, so it may look a little bit funny because they got all these dots on their face. All right, let's see if I can get this slide forward again here. There we go. So protocol, we just have patients clean the face thoroughly, use an acetone scrub. You want to get all the oils off the skin because the oils on the skin will increase resistance. So what you want to do is you want to really get all that oily stuff off so you can get better penetration. We do use topical anesthetic on anything except program A. You don't need to use it really, but program B and C, you definitely want to use topical anesthesia. And for this, we actually have patients come in to the office an hour before. We do the same for our other fractionated devices. Where they come an hour ahead, and we really goop it up with the stuff that we find. We have a compounded version, topical anesthetic. Because if patients put it on at home, they never put enough on, and then it's often inadequate. So you want to really be in control of how much you put on. Then at the end, before treatment, you do have to remove the anesthetic because that's creamy and greasy. So you want to remove it and clean the skin, and then make sure it's totally dry. You don't want to have water on there because using electricity, if you have water, then it just short circuits things, and the electricity goes over the skin instead of into the skin. Then, so the cleaning is kind of key. Once that's done, then you pick the program and then just do one pass on the face, clean periodically, and you're done. After treatment, you can do actually cold packs during treatment. So after you've done part of the face, what I have the patients do is one of those instant cold packs, which are the chemical ones, and then you put it on that area while you're doing the other side of the face, and that really helps patients be comfortable. You don't want to use ice because if you get water on stuff, again, that's going to cause problems with the electricity. And then afterwards, just instruct patients, as you would after any resurfacing procedure, to use strong sunblocks and avoid direct sunlight to minimize the risk of possibly hyperpigmentation. And here, this shows you really what it looks like on the skin. This is, of course, somewhat magnified, but you can see program A, one day, very little left. Probably by 48 hours, you won't see anything, maybe tiny hint of redness. Program B, a little bit more, and then program C, clearly more aggressive. Still nothing like what you would see with CO2 type of approach. So, now I skipped over, but now this is sort of a little bit outside my area, but of course they do, provide you all kinds of help with marketing if you decide to go with this device to add it to practice. That Syneron is, we worked with them for years, and they've always been very good at trying to help out with your marketing of the device. So again, conclusion: at this point, the only RF technology for fractional ablation and coagulation. So the combination, I think, is really neat. And then you've got this very, very cute device, cute machine, small, cute machine, and I believe it is a lot more affordable than some of the other ablative fractionator devices out there. So I think that's all I had to say, but I'm glad to take any questions or if there's anything else that Courtney wanted to add.
Yeah, absolutely. Thank you, Dr. Hruza. Thank you very much for your presentation. I do want to mention before we get into the question and answer session that this product will be shown at AAD this next coming week, and our booth number is 5158, so if you want to take an opportunity to come and check it out, we will be at AAD. So to get on to some of the questions that were asked during the session, one of the questions, Dr. Hruza, that was asked is, does this device tighten skin? I think you addressed that a little bit, but if you maybe wanted to clarify again.
Well, the skin tightening part of it, in our study, we saw a bit of that, kind of almost as an aside, because we were not specifically looking for that. So I think it will tighten skin, but I don't yet have enough experience with tightening it. So I have not used it primarily for that indication. We've noticed the tightening as sort of almost as an aside. So I have not done that much in that area yet. But part of it is because I think for the tightening, you really need to go with the C program, which we've just had for a brief period of time. But I'm certainly hoping that with the depth that it can go, we should see some of that as well.
Okay, wonderful. Thank you. The next question I have is, compared to fractional CO2 regarding results in downtime, how does the Matrix RF compare?
Well, the Matrix RF has a dramatically less downtime. That's, I think, the key component. And the results so far, at least as I show you in the periorbital area, seems to be comparable. So at this point, it looks to me like you can achieve results which are quite comparable to fractional CO2 with a lot less downtime.
Very good. Another question that was asked is, are there issues of blistering with Matrix RF?
We have not seen it, except we've had actually just one blister on one patient, and that blister resolved without any problem. And I believe the reason we had that it was still one of those, still a prototype device, and some of the, I think a couple of the little electrode tips didn't function correctly. But since we've had the commercial version, we haven't seemed to have any problems with that. And even that one blister we did get resolved without any problems. So I think the risk would be more likely, the key thing not to have anything is just as long as you follow the basic rule of cleaning the tip regularly. Because I believe maybe what happened in our one case was that we probably didn't clean the tip, and then there was probably enough of a build-up, so you got a short circuit across a couple of those the electrodes, and that caused a superficial singeing of the skin and got a blister. But the nice thing is that even with a blister like that, there was one blister, even though we treated most the whole face, it goes away because it's a very superficial injury. It's only epidermal injury.
Yes. Next question that I had is, how does this compare with Fraxel or ActiveFX in terms of cost? I guess I can address just the cost because a couple people have asked. In terms of the product itself, there are options for purchase of the full unit. There are also options of a subscription unit for it as well. The list price on the full unit is $69.9, and the tips themselves are $75 for a 125 pulse tip. So those are some of the pricing. Do you have any information, Dr. Hruza, on the comparative?
We also have in our practice the Fraxel devices, and those are about twice the price on those is about twice. On the disposables, they end up being somewhat more, but they're disposables that they're count a little differently, so it's a little bit trickier to figure out exactly. But I have a feeling the disposables, those disposables are still a lot higher because how much each one of them costs. So you're looking at this probably twice. And I do not know what the price of the ActiveFX. I do not have that. The ActiveFX is comparably probably the most aggressive of the three. If you're looking at those as far as how aggressive and downtime wise, how those are.
And along those same lines, Dr. Hruza, how much would you recommend charging for patients for this procedure?
That all depends on where you practice.
Sure.
Because if you're in New York, it's going to be very different than when you're in the Midwest, where we're kind of much more conservative in our pricing. So it's a tough call. But we really do charge for these very similarly, and it's in the range of. Because we often do partial faces and full faces and different areas, and the range that we do, years ago we started with the Fraxel. We started, I think it was like $1,000 a treatment or $1,200 a treatment. With that, we don't find it sustainable anymore, at least not for us. And certainly with this device, where we can do it in much shorter period of time, that seems unreasonable. So we're more in the 500, 600 range, 600 for the face, 600, 700 sometimes. Or we do packages, maybe a list of 800, and then it comes to $600 per treatment if you buy the whole package of 3. So we're kind of more in that range right now. So we're in the mid-hundreds, mid to upper hundreds. I think it's difficult to get over $1,000, at least not in our area.
Very good. So I'll go ahead and just ask 2 more questions since I know we're running short on time. One of the questions asked was, is there a risk in treating acne keloid scar area in patients with non-keloid scars? I know that there's you've talked a little bit about treating acne scars. If you wanted to address that.
Maybe could you say that again? I kind of didn't follow, because it certainly wouldn't. If someone has keloids elsewhere on their body and they have acne scars, you can probably treat them okay.
Right. That's
with this device. That would be fine. I would be more leery if they actually had keloid scars on their face, then I don't think this would be the device. I don't think we have enough data to say that this would actually be helpful. There's some anecdotal data for fractionated devices for keloid scars, but I think that's still, I would say, quite preliminary. So But if they have a history of keloids, as long as they don't have them on the face, so they just have traditional acne scars on the face, then they should be fine with this kind of treatment.
Okay, last question we have for you. Matrix RF combined with other treatments, how do you see this working out, IPL, skin tightening, the other treatments, photofacial?
Well, in our practice, that's exactly how we use it. We use it as part of the sort of the Trinity, or maybe now it sort of becomes almost they call it Trinity, but really it's 4 levels because it depends on what the patient has. But if they have erythema, telangiectasias, we will start them off with doing the traditional photofacial IPL RF type treatment, and then then at the same treatment, then we will layer on the other components depending on what else they have. So since we do have several devices, we've been using the ST, or the Refirm ST, for the skin tightening, and then the Matrix IR for stuff for the mid-level stuff, and then the Matrix RF for the somewhat more superficial stuff. So we will actually often layer things together at the same sitting. You do have to be aware that if you do put layers of stuff, then you do have to back off a little bit on the energy, because you've put a lot of energy and heat in the skin already, so you do have to adjust that. So it may not be the first patient you would want to use all 4 devices on, all 4 handpieces in the same treatment. But certainly for us, we treat more patients where we actually do it as part of the overall package. And then you do charge a bit more, by the way. Then it is kind of in that $800 to $1,000 range for when you do a full treatment with several different handpieces. Then we will be. Then I think you can get into that. Then you can get into $1,000 for treatment. So we do the we actually often do the combination, and I kind of like to put the Matrix RF when I go for specific areas on the face.
Very good.
I hope I answered the question there.
I'm sorry?
I hope I answered the question.
I believe so, yeah. Thank you very much. Thank you for your time, Dr. Hruza, and this webinar will be replayed on Syneron.com if anybody wants to go back and listen to it again. Thank you, and have a good evening.
Great. Thank you.
Bye-bye.